Anatomy 32, Chapter 15, the lymphatic system and immunity. Topics, organs and tissues. So the lymphatic system has a variety of organs and tissues that are separate from the vessels we talked about earlier. These include the primary lymphatic organs. Primary lymphatic organs produce immunocompetent lymphocytes. They produce the white blood cells, lymphocytes that are able to function. And these include the red bone marrow and the thymus, which unfortunately we can't see in this picture, but would be located somewhat superior to the heart, found in the mediastinum. The secondary lymphatic organs and tissues include the lymph nodes, which are lots of lymph nodes throughout the body and are found along the lymph vessels. The spleen, largest of the lymphatic organs, lymphatic nodules, found in various areas, especially the tonsils, and other tissues found in various organs. So lymphatic tissues are found in a lot of different places in the body. All right, red bone marrow. As we already know, all blood cells are produced in the red bone marrow, and this includes immunocompetent lymphocytes. These are lymphocytes that are ready to function. So the red bone marrow produces pre-T cells, these lymphoblasts that are not functional, and it also produces B lymphocytes, B cells, and natural killer cells, which are functional, and as well as all the rest of the blood cells. B cells, B for bone marrow. B cells travel to other lymphatic organs and tissues where it will help to screen for specific pathogens. So each B cell that's produced is looking for a different pathogen. So some are looking for influenza virus, some is looking for COVID viruses, some are looking for HIV virus, I don't know, lots of different things. If that specific pathogen is detected, then that specific B lymphocyte will activate and rapidly divide. And while it's dividing, it will become one of two different kinds of cells, either plasma cells or memory B cells. The plasma cells then produce antibodies against that pathogen. So if it's the influenza virus that activates it, those plasma cells produce antibodies that attack the influenza virus, that attack specific antigens, that is, specific surface structures on the virus. So that's what the antibodies bind to, antigens found on the surface of the virus in this case. And then some of the new cells, B cells being produced, will be memory B cells. Memory B cells basically remember that you have been exposed to that pathogen, have had an infection, and will help to generate a more vigorous and fast response in the future in case you're exposed to that pathogen again. This is what we refer to as immunity. If the memory B cells do their job correctly, then the next time you're exposed to the pathogen, you won't get sick. Then we have the thymus. Thymus, again, is an organ found above the heart in the mediastinum of the thoracic cavity, and it is the site of T lymphocyte maturation. So the pre-T cells go to the thymus, and there they differentiate and mature into one of four kinds of T cells. We have the helper T cells. Helper T cells help to regulate the specific immune response. They initiate, they stimulate the specific immune response for a specific pathogen. So again, if we're talking about influenza virus, there is a helper T cell out there that is specific for the influenza virus. And when we get exposed to the flu, then it will stimulate B cells to become plasma cells to produce those antibodies, as we mentioned earlier. And it'll also stimulate cytotoxic T cells to divide and become active to destroy infected cells. So helper T cells turn on the specific immune response. Regulatory T cells have the opposite function. They turn off the immune response. Once the pathogen has been destroyed, the infection is over, we don't need to waste resources on a hyped up response. So once you have recovered from the flu, the regulatory T cells will dampen down the specific immune response for the flu. Then we have the cytotoxic T cells. Cytotoxic T cells destroy cells of the body infected by that specific pathogen. So cytotoxic, cell toxic. So again, if we're talking about the flu, cytotoxic T cells will destroy body cells infected by the influenza virus, and only body cells infected by the influenza virus. They would not destroy other body cells infected by other things. And then there are the memory T cells. Memory T cells act just like memory B cells. They remember that you've been exposed to this pathogen, and if they function properly, the next time you get that flu virus, you'll have a more vigorous and rapid response, which will hopefully prevent you from getting sick. And again, this is what is referred to as immunity, having such a fast immune response that the pathogen does not make you sick. And thymus, unfortunately, fades away over time. As a person ages, the lymphoid tissue in the thymus gets replaced with fatty tissue, so elderly people have a reduced immune response. It's much easier for them to get sick. Lymph nodes, a secondary organ structure of the lymphatic system. Lymph nodes are masses of lymphatic tissue surrounded by a capsule of dense connective tissue. Look kind of like this, sort of bean-shaped. They are officially organs, two different tissues. They're scattered along the lymph vessels, so lymph vessels are going into and coming out of the lymph node. And they're scattered throughout the body, but there are areas where they are in large groups, such as around the mammary glands, the armpits, the neck, and the groin. So again, the lymph fluid traveling in the lymphatic vessels will enter the lymph nodes via the afferent and lymphatic vessels, and then exit the lymph nodes via the efferent lymph vessels. And when the lymph fluid is within the lymph nodes, they pass through this mesh-like structure where there are macrophages and lymphocytes. And this internal mesh-like structure acts as a filter that traps foreign pathogens, cell debris, and so forth, cleaning up the lymph, as well as allowing the lymphocytes to become exposed to specific pathogens, thereby allowing the specific immune response to initiate, to occur. It's important to try to get your immune response to occur before pathogens get into the bloodstream. So that's why having these lymph nodes screening the lymph, which is the fluid that came from tissues, can be so important. And the lymph, as it travels through the lymphatic circulatory route, gets filtered multiple times by traveling through multiple lymph nodes. The spleen. The spleen is the largest organ of the lymphatic system. Again, it's a secondary organ. It's located in the upper left corner of the abdominal cavity, directly lateral to the stomach. So here's the stomach, here's the spleen, sort of squished in there. The spleen contains two different functional tissues. It has the white pulp tissues, which are lighter in color, and the red pulp tissues. And it is screening and dealing with the blood itself. So the spleen is the only lymphatic structure that is screening the blood itself. In the white pulp, there are B cells, T cells, and macrophages that are carrying out the various immune functions. So they are screening the blood for pathogens. They're looking for pathogens in the blood in which to generate immune response against. And in the red pulp, there are three main functions. There's the removal of aged, non-functional erythrocytes and thrombocytes. So removal of red blood cells and platelets, aka erythrocytes and thrombocytes. They don't last forever. It stores platelets or thrombocytes to release those thrombocytes in the case of severe blood loss. And when we were a fetus in the uterus, it produced fetal blood cells, fetal red blood cells. Lymphatic nodules. Lymphatic nodules are secondary tissues that are found in different areas of the body. They're not organs because, again, they are just lymphatic tissue masses. They are found in a few different regions, primarily around the appendix, found in the abdominal cavity, around regions of the small intestine, where they're referred to as the aggregated lymphatic follicles, and within the pharyngeal region, in the throat. And there they're called tonsils. And we have 5 tonsils: 1 pharyngeal tonsil, 2 palatine tonsils, and 2 lingual tonsils. And these lymphatic nodules are located in regions where we often have invasion from pathogens. So the pharynx, the throat, lots of things we breathe in or we swallow will reach the throat, reach the pharynx first and try to invade into our tissues there. So tonsils are there to help. Within the small intestine, a lot of pathogens try to enter deeper into our tissues from the small intestines. And then, of course, the appendix stores a lot of bacteria, and if things go wrong, those bacteria may spread into other tissues of the body. So lymphatic nodules possess the immune cells, B cells, T cells, macrophages, and the goal is to stop the infection before it gets deeper and or stimulate the specific immune response. So stop it before it gets worse and or stimulate the specific immune response so that the whole body is hyped up and ready to deal with that specific pathogen. Some disorders. You have the ruptured spleen. Ruptured spleen, well, it's from some sort of abdominal trauma. Someone gets hit on the left side. It damages the spleen, causing hemorrhaging, significant blood loss. A person can go into shock, and it can be treated by splenectomy. So the spleen can be removed. You can live without your spleen, but you will have a reduced immune response. And then there's tonsillitis. Tonsillitis is a persistent infection or inflammation of the tonsils. Often occurs repeatedly, or when it occurs is very, very severe and potentially closing off the throat, making breathing and eating very difficult, often caused by some kind of virus. The treatment is a tonsillectomy, removing the appropriate tonsils. And it's a rather common surgery, and as far as we know, there's no apparent effect on the immune response, so the tonsils aren't as important to our immune response as is, say, the spleen. And then that's it for this part of the lecture.